Well, hello everyone. Thanks for being here and chatting with me about this. Do you want to go around and introduce yourselves first?
Sure. Thanks for having me. Thanks for showing up, by the way. This means a lot. My name is Ronnie Drigg. I live in Vancouver, BC. I've been a long time frontline harm reduction worker. My focus has been in supervised consumption spaces. I've worked there for the past 15 years. I'm the ED and founder of a harm reduction nonprofit called the Zero Block Society. And I'm in Ottawa for an event on Saturday, March 9th for a screening of the documentary called Love in the Time of Fentanyl, and I'm one of the subjects in that film.
Thank you.
Hi, I'm Candace Christmas. I'm the Community Support Engagement Manager for a project called supportnotstigma.ca. It's based out of Kingston, but I am a resident here in Lower Town.
I'm Paul Tulloch. I'm a friend of Ronnie's, but also, community activist and trying to understand this subject and worked in policy for a long time. So
I'm Mark Cunningham, a blue collar worker at a homeless shelter and a longtime friend of Ronnie's.
Timothy Meisenheimer. I'm a street worker for pretty much since '99 solid, and involved with similar what Mark is at as a mission, and a storefront drop-in center for 24 years. So I'm a longtime friend of Ronnie. We met in a drop-in in Sudbury, really, and we were much better looking.
Well, I'll introduce myself. I'm Nathaniel Newton. I host a Monday morning radio show on CKCU, the Carleton University radio station. I've been there for about 6 months, but before that, I've been doing independent journalism, just covering different things related to the Ottawa region. Since about 2015, I was involved in the cannabis prohibition activism to try and get that to become legalized through the rallies on Parliament Hill and other similar situations. So
Can I jump in?
Go ahead.
And I want to give a shout out to Campus and Community Radio. That's where Mark and I met. I started in '86. What year did you start? Around there?
About the same.
1986 in Sudbury, Ontario, Canada, CKLU. It's kind of like independent media has been close to my heart for ages. So glad to be doing this.
yeah, the more I learn about it, the more I realize how much it helps the community, how important community radio is. And we are listener supported, and we appreciate all of the people in the community that support us and have for coming up on 50 years in November.
Wow, amazing.
Congratulations.
That's crazy.
So the reason we've got together here was for the screening tomorrow. So there's a documentary called Love in the Time of Fentanyl, where you are one of the main subjects of the film, and it goes through what it's like to be a frontline worker in the opioid crisis in Vancouver. And I'm wondering if you could just chat a little bit about it, what this was like.
Yeah, about the film, like about being involved in a film project like that.
Yes, for sure.
Yeah. Well, I mean, the thing about supervised consumption sites and overdose response is that it has been a very unrecognized response and a need, and especially as black market fentanyl surfaced on the streets in the downtown east side, what many people call a poisoning crisis related to the incidences of death by overdose increasing at rapid rates and continuing to this day. I was staff at the first supervised consumption space in Vancouver, Insight. It was established in 2003 and was the only one on the continent and one of two outside of Europe until 2016 when this crisis hit, and the overdose prevention site in the film was one of the responses that increased the funding and the opportunity for that, and that came through community organizers and really a crisis response when no one else was responding.
Mhm.
I wasn't one of the founding people in that, but I was a manager there for a couple of years, and the film represents part of that.
It's a really hard subject for a lot of people to approach. It's a lot of people. There's a lot of stigma around it, and a lot of people have. I feel like there's a lack of education a lot, and I'm hoping that the film will help to bring people into the world and show them what's going on right now. Do you feel like it's going to be that's something that will happen?
Well, I what I believe and why I thought, one additional thing I'd say about the film is that that it was unexpected, right? This wasn't a project that I initiated or that I was expecting to be centered in. But one thing that I knew was important about projects like it is that the stories aren't being told, right? We have a lot of policy and research language, like a lot of evidence-based resources that say these services work, right? But a lot of people don't know how to think about it, don't understand it, or are afraid by it. And the thing that I've found in my experience that bridges that understanding is our stories, right? It's been true in my life with working in Vancouver, but having most of my extended family in Ontario. That I had to bridge that understanding of what I do out there and try to describe it and how people understand, right? And it wasn't my the evidence, it wasn't research, it wasn't policy, it was the stories of the encounters I have, the impact on me, the impact on others that really changed me, right? And so how we get the stories of the people doing the work out there is a challenge. So this film has been a great vehicle for it. But also as my work since that time in the past 5 years has been with this nonprofit, the Zero Block Society, and that effort is to try to find a variety of ways to push the narratives forward, and to have those narratives are trustworthy because of the research and policy. These guys to my right here,
Yes.
who do a lot of that work, and that's important to support people showing up into and engaging in difficult spaces, but meaningful and necessary spaces. So as much as this film is that vehicle, it's been super well received, has American funding. So a lot of U.S. communities have appreciated it. It just makes it visible. It's like, hey, I know what this feels like. Workers. There were some here earlier today saying, people could see what I do and what my workplace is like.
Yeah.
And there's so few of those opportunities,
And I think that's an important point to make is this film, a lot of it is graphically about the work, which means the people that are being served. But what is important not to get lost in that narrative is the people doing the serving. And so really what's happened in the drug poisoning crisis is that frontline harm reduction workers have become what are called the first responders. So before ambulance or anyone gets there, in fact, how many cases have been diverted from hospital? I mean, from a healthcare perspective and from a funding perspective, those numbers are massive. But what has happened is it's created a massive burden on people who are workers, who are experiencing PTSD and moral injury. And furthermore, these are people who are often just being paid $20 an hour without benefits, versus when you compare that to, for example, to a paramedic who is making a lot more money, who has mental health supports, who has time off, who has benefits, all of that. I'm hoping people will really kind of glom onto the incredibly important work that harm reduction workers are doing on the front line, because really and truly, it's a very, very difficult road to walk, and they're losing people that they care about, and they're losing friends, and by and large, a lot of the stories just really them as peers being able to support each other, because really the structures are not supporting them at all.
And I think that's a big point, is the institutionalization of our traditional means of dealing with, a professional approach to health care and mental health, which has been inadequate and has been eroding. That's what we've tried to push out to that. and it's failed. And spaces like what Ronnie has created and driven the expertise and the knowledge and the action needed has been almost put at odds with the traditional approach to it. So it's from a policy perspective, there's so much to learn from this movie and trying to integrate how do we approach that and move forward.
And I want to point out that before we started recording, the local people from Ottawa who do the work made sure they left, right? And and so just to acknowledge that there isn't the freedom to speak about the intensity of the experience because of media policies and non-disclosure agreements when things go bad, which is not something that's happening in BC yet, but I'm hearing it from harm reduction workers in Ontario that when a critical incident has happened, like a part of the care is a non-disclosure agreement, and that's new to me, and that's sort of why I'm willing to leverage my position that I'm an outsider in the community and to talk about these things, because people are like, there is no way I can risk my job or risk being known to be a disruptor or agitator in this corner, right?
Mhm.
So I am aware of the privilege of that, of being the one sitting here talking about it and the light being shone on me. And that's because there not only are there inadequate supports, but there's a mistrust of what happens if we do speak out, and that's active. That's
You become a target.
Totally.
100%.
Especially right now with last week, I think it was, we had 2 of the consumption sites, which is 50% of the capacity in the city, closed down, and it's indefinite. Like, we're not sure when they're coming back. And that's caused a significant increase in the load at the other locations. It's definitely something that we need to, as a society, be more involved in.
The urgency is kind of focused honestly around this week, and it's not because of my events, but
Happenstance.
because of what
Yeah.
you're talking about. And the Canadian Drug Policy Alliance has put out there was a provincial meeting for Ontario specifically to put out an open letter to not only stop closing these sites there, and some that are close to my heart are in Sudbury, my hometown, in Windsor, Ontario, which is represented here. These are both sites that are physically in existence, that have been and again, I'm not speaking for them. I'm pointing towards other news sources that the Canadian Drug Policy Alliance has put out. They have physical spaces. It's set up, but have been funded by the local communities, right? Waiting for support from the provincial Ministry of Health that isn't coming. In fact, cuts are coming.
Haven't they put a moratorium on that right now?
Yes.
As of October, there's a moratorium on the
There's the creation,
approval.
no creation of new sites,
Yeah.
period. Full stop. And when you consider how many people are dying, we need more quickly.
And so the open letter from the Canadian Drug Policy Alliance was to have 51 more sites funded. And that was released, I think like a couple of days ago, like it's current as of this
Understood.
And I
Thursday.
mean, the action that policy and government are pushing forward right now with these cuts is totally at odds with what families, communities,
Absolutely right.
workers in these fields, police, EMT, all these want. They want to draw on and build these types of resources, and yet being cut.
I feel like we're touching on a broader issue that's happening right now, especially in the Ontario health scene, with the cuts and reductions to healthcare. Kind of like they're trying to push out the public system in favor for a more privatized for-profit system. I've been following the Ontario Health Coalition a lot as they've protested at these different for-profit
And
clinics.
these cuts do matter because they do create more bodies, more deaths, and it's not operating in a vacuum where he's just, we're going to cut and we're going to try to privatize. This is actually creating harm. People are dying, and institutions that were slowly or community level responses that were slowly forming are now being pushed backwards, and that's crazy.
But it's ideological too.
Yeah.
So you have to be
It
careful.
is.
it's been the shift in narrative has been now about treatment, but really to access private treatment, you're talking 30 to 40 grand a month. How many people have that? In Kingston, we have, for example, one treatment center for 135,000 people. So what do you do with that? The other piece too is what we have understood through the evidence is that it's not as simple as just finding someone in a treatment bed. People need what's called stabilization. So particularly people who have been street involved for a long time, you can't just plop them into a treatment program, which is typically abstinence-based, and assume that this is going to solve the problem. They really need to get to a certain level of mental health as well as physical stability before they can even approach the concept of treatment. Throwing them into a treatment center is setting them up for failure immediately. And then the first thing we do is then we put that on the individual. Well, the individual failed. Well, actually, we didn't provide them with what we know is evidence-based best practice, which is to create a stabilization for them. So one of the things that we need, not only safe consumption sites, which is literally keeping people from dying, is then, transitional situations where, whether that's in a shelter environment or in secondary housing, is that we have wraparound care for them to try and get them literally well enough that they can maybe be successful at treatment.
And the first stabilization is housing, right?
The affordable housing crisis is a big deal right now. I was actually, I had to stay at the Ottawa Mission for a few weeks last year before I was able to find a new place to live. And
Wow.
I was very lucky to find one that I could afford. And the price of rent compared to the income has gone up so high that right now it's almost impossible to pay a rent with a roommate if you're supported by the Ontario Works or something like that. You almost need 3-4 people together just to pay the rent.
Yeah.
Ronnie, I wanted to ask you, if you don't mind, do you feel like when you first started in this space years ago, and it was more of a Vancouver, bubble that they called it, and then it's become, an epidemic right across Canada. Do you feel that something like what, say, Doug Ford's doing right now and cutting and trying to, pull money out of healthcare, which has resulted in, pushbacks and availability of help, like what your groups have been able to do in our community? Do you think because it's become such a widespread issue affecting middle class, all sorts of families that it traditionally didn't affect, do you think that will become an election issue? Do you think that that'll resonate with voters?
It has to in some manner. I think what is overtaking the narrative is policing as a means of solving a lot of problems, right?
Okay.
Which is also an expensive solution. And incarceration, it's a very expensive solution. And they actually are the data, right, that we have. The war on drugs, and policing and incarceration, that's what we've been doing for, 100 years, but like the past 60 years, let's say. And we're in category worse than ever, right? It doesn't work. It won't work.
Yep.
There's a move towards like forced treatment, stuff like that. I mean, incarceration is essentially like a type of forced treatment. And the people who are leaving incarceration environments are the most amongst the category that are most at risk of death by overdose. So, I mean, we do need solutions. We can't be, I think as people in, like, as caregivers and people in a harm reduction movement, we can't fight for it to remain like this.
Yeah.
People are suffering,
Yep.
right? We need like more focused and comprehensive solutions, but to lean on these punitive approaches that we've had, they don't work.
But a new political regime, like definitely with a different take, would help.
It matters, right? It does
matters to get out
matter.
and vote and
Yeah. Especially, and I am pointing out that the political narrative is dominated by that blame, right, of harm reduction and safe supply as creating this crisis when we've been trying to play catch up,
right.
with limited resources, limited priorities, I've been able to visit communities across the country and across the continent. And everywhere I go, like I would love this is maybe the next film idea. Asking harm reduction workers of examples of well-resourced workplaces that it'd be met with laughter, right? And because there are none,
What
right?
was that place you were talking about today in a meeting in Paris, was it? Where you asked
yeah.
you asked the person how many
Yeah,
that sort of-
I would. I'll just tell you about
Yeah.
that. I was recently in a knowledge exchange, a Paris Vancouver knowledge exchange, related around overdose response, encampments, and pre-Olympics, like
Operation.
activism and resistance. So the Paris Olympics are coming up, and a part of the impacts and the stress on this community in Vancouver is a post-Olympic, outcome as well, as far as housing, gentrification, the homeless population being like pressed into smaller and smaller areas and stuff like that. So the reaction to the downtown east side, the visible reaction of people, it's they've been forced into smaller and smaller spaces, and so this in Paris, like they're experiencing the same things, and so on. So a group of us went over there, and my involvement is around supervised consumption spaces. I got a tour of the one over there, the first one in France. I think it may be the only, but I'm not 100% certain of that. And so we had the tour. It was a great space. I know the organizer that set it up is a friend of mine over there. And at one point I asked him, how many overdoses do you average a day? And he shrugged his shoulders and he said 0. And I'm like, I couldn't, like my brain flipped, because they're like, they didn't, the most crisis they had to deal with in their site would be a mental health situation, like a psychosis or something like that, right? And I honestly can no longer imagine not preparing for multiple crises like at the same time, right? And I'm like, you just get to offer services, right? And like, what would that be like? And the circumstance around that is there's no fentanyl on the streets. In the area around that site, the drug users used pharmaceuticals, so they would come in and they would know
Base supply.
Yes.
how much morphine they were using. It was the same as yesterday, and they knew what they were using. And if someone was showing symptoms of, like a onset of an overdose or whatever,
they had the resources.
and they were beside a hospital, right? If they really needed to wheel someone over. So it was arresting. Like I didn't know how to think about it, because I'm like, you don't have to manage for multiple crises at once. It was quite amazing. It should be like that.
And that's one of the problems too that we face is sometimes the medicalization of solutions, when really folks need, we talk about stabilizing people. They need housing. They need compassion. They need reconnection with family. They need to be with their own communities, because they don't have any other ones. Most people's family relationships and so on were long severed due to the stresses of street life and so on and so forth. And so, there's this sort of naive thought that, we can just put together medical teams, or even for that matter, addictions and mental health teams in the classic sense. We need a lot more than that. I mean, the people that I know that are the best at their jobs in harm reduction often don't have a degree. They're usually people with lived and living experience. And they live for the job of making people feel validated, making people feel like someone on this planet actually cares whether or not they live or die. And I think that's something, again, from all the way from a policy perspective outwards, that we really have to think about, because these are the most marginalized and vulnerable people in our communities, period, full stop. We layer in intersectionality with that. So there's more Indigenous folks, there's more people of color, et cetera, et cetera, et cetera, right? So, but really and truly, if you want to talk about the people that are the most marginalized, it's people who use substances. Always, because it's viewed as a personal choice.
It's so much more complicated than that.
Yeah, you can come in here and have a beer.
Yeah.
And it's totally
Saves the life, man.
acceptable.
Saves the
It's,
life.
it's culturalized, it's acceptable, it's this, it's that. And you know, we were talking about prohibition. There was a period of prohibition at one point. So it shows you culturally how, you know,
A lot of people
frozen in
died then.
time people's thoughts can be.
During the alcohol
On purpose.
prohibition, during the
People
alcohol
died.
prohibition, people died from a poison supply of
Yeah.
alcohol.
Mhm.
And crime.
Until the government regulated the alcohol again and made it safe for people to enjoy.
So there's a lot that history can tell us. So there's a lot that, you know, international or different communities. There's always success in building these solutions, right? We just have to look. And Ronnie is a perfect example of traveling here, traveling the world, actually telling, you know, his experience. He's been through how many years?
15.
15 years, and it's a war zone. He's seen stuff that most humans shouldn't see, right?
Yeah.
And he's survived, and he's here talking and
Thank
telling us stories about it. So it's an amazing.
So I'm just listening and I'm thinking, it's going to be a long view to change this. And thinking about how, we have a pandemic demonstrated senior homes and the values for seniors with very less complicated, really, circumstances than being homeless or being maybe someone didn't have anybody else to care for them except the staff there. But let's just hope that some of them, had all that built in. Usually the alienation of it is part of everything. And that's why the connectivity. But thinking about, how the way to go usually, you're doing education with the movies. But what about an idea around PSWs?
What are PSWs?
Personal support
Okay.
workers.
I'm from BC.
Yeah.
We speak a
Yeah.
different language.
Anyway.
Personal support workers.
Yeah,
Yeah,
personal support workers.
Care for seniors.
Okay,
Yeah,
got it,
but
got it.
so I don't know, 20 years ago, that wasn't a topic anywhere in Ontario either. But now that's a whole thing because of Algonquin College, Cambrian College, St. Clair College, and not people that would be ever interested in, and it's not a long training program, but to legitimize the actual
Work.
frontline worker.
Mhm.
Great.
Because until that happens, we're gonna keep on saying, I'm sorry, we don't really respect this. This is like I've been a peer support worker myself for many years, but people are like, what are that? What criteria do you have for that? Well, I've lived
Yeah.
experience, right?
Yep.
And so, isn't that something we should be having a
great
discussion with?
I'll tell you. Can I
Sure you
respond?
can.
Because I do have an inner reaction, and I like every time I hear that kind of stuff because of this thing because there was a program in BC that was set up of harm reduction workers certification, and the people running it had never reversed an overdose, blah blah blah, all this stuff. So then their students come to me, and I'm like, oh my god, those guys get you pay $5,000 to these people who've never done, so I get, and what I'm acknowledging is my reaction is sort of this protection of the experience, right? And the protection of being co-opted by, other organizations to say, this is what it's like, because I and many others have never been consulted. What's it like? What should we do? What do you know? Can you, we've had to fight to be at the table. And I'm like, I almost feel bad saying it, considering the experiences of so many other people, and threatened by health authorities and police and all of that stuff, just to be at the table and say, can you hear our experience? And I'm just acknowledging, not that it's a bad idea, but that when I hear that, I'm like, oh, how does that play out, right? And who gets, you know what I'm saying? There are programs that make money certifying harm reduction workers that no one's ever reversed an overdose, and you know what I mean? That kind of
And I mean, the you go back to supply and demand there. The economist in me wants to jump out here because we were talking today earlier about, some new occupations that these overdoses are showing up in, and it blew me away. The
Yeah.
construction
Oh, that's
construction sites are starting to see, with the decline of healthcare and inability to access healthcare, self-medicating.
It's not starting. That is
Yeah,
in
yeah.
Ontario. That is
So
our highest demographic.
You have a demand increasing for this kind of service, and then you have a supply of accreditation of workers still not being formally acknowledged, or if, in your case, what you just mentioned, accredited in a very inadequate way.
I don't want to get back to bridging that accreditation, but keep in mind the experience of construction workers is it's always been there, but you can manage it with heroin or opioids like that. Now it's
Fentanyl.
fentanyl
again.
Fentanyl, benzos, xylazine,
Yeah.
and you can't. The negative, like the crisis outcomes are immediate, and so that's why it's more visible, right?
That and
Crisis.
the inability to get into sales.
Well, and they use a loan. So this is the other thing that happens is that construction workers are typically set up in a hotel room, and this is what happens. And this is again one of the contradictions that we learned about COVID was we did this to people who are substance users and we isolated them. And then the overdose rates went through the roof because they often are protecting each other, right? So if someone's on a nod, you're checking out your buddy, you're making sure. And that's one of the structural reasons why construction workers are so vulnerable is because they are isolated and they are using alone and we don't have anyone. Literally, it could be a policy like we do in our shelter is to go around and do checks.
Yeah,
You know?
that was
And there's technology. In fact, it was built out in BC. You can speak to that, Ronnie, where there are actually monitors that you can put in someone's room, and when they use, they activate the monitor, and if they don't hear back from someone, then it raises an alarm for someone to go in and check in on them. So there are solutions, but we're just so naive in terms of what is actually happening. And I think that goes to the idea of the curriculum is that, as we've said, with any policy that we're developing for the community of substance users, we connect with and consult with the experts, which are people with lived and living experience. Period, full stop. They know what they need. We did a needs assessment in Kingston in 2021. We interviewed 32 people. We learned a heck of a lot about what we needed to do, and then we developed programs around that. We need to do the same thing with the curriculum. Right. And we need to not only have a harm reduction curriculum, but we need to be teaching harm reduction to police officers, to nurses, to social workers, because all of these people are also touching the lives of people that they don't fully understand what is presenting and what is happening. So at baseline, that's what we need to do. Bring in people who lived and living experience. Right.
Yep. But yeah, I want to say something yes. Absolutely. The accreditation piece, me acknowledging my reactivity is because it has been, people have with lived experience both with substance use and with the response to this crisis aren't consulted and overlooked so often. But that is what helps us be visibilized and known and that we are a thing that communities need. We are a response. The policing thing, again, I'm reacting. But no, it's
cultural.
Here's the thing, right? Is a lot of people say police should be trained better, blah blah blah, all this stuff. And I'm like, you know what? We should look at community safety beyond what the police can deliver. Right? And community safety is important. In many places, police are the problem that make communities unsafe, right? And I would say in my community, that's very true right now. And so the people that make the community safe go far beyond police, right? And that if we had that common language around community safety being important, it would need that acknowledgement, right? I feel I've been involved in community safety all through this work, right? I've solved a lot of problems for police. I've solved problems for the medical system. I've solved mental health and like problem, like
Paramedics.
Yeah.
solved a lot of problems for those systems, right? And that contributes to community safety, right?
You're going to be the dean of the school.
100%.
Well, one of the issues when I
I don't want you reacting.
Yeah, I
But
didn't react to
I
that.
do know we need, I think, in order to be legitimize this ragtag
Yep.
bunch of people.
Your idea is right. My reaction is wrong,
Yeah.
but it exists,
But,
and that's
well,
why.
no, and not like Bob's running a course there for $5,000 and he'll teach you how to be a frontline worker, you know? To be involved with, you know, the covering of a provincially supported school.
Yeah.
Right, that has a course now, but the criteria is that it has Ronnie as the president of that department and other Ronnies.
Or insert other,
Yeah,
And
other
you know,
names.
what scares me is, you're in Vancouver and, they've had this issue there for a long time. They've had a lot of experience with it. A lot of institutions trying to dabble and figure it out, how to help, somebody that's like yourself. But then you also think about Canada and its demography, right?
Yep.
I was working with the RCMP on a project up north. There's like 300 communities with one police officer that's the EMT, the doctor, the nurse, everything. And then you take that and imagine going across Canada with all our small communities. How do you roll out? If you can't do it in Vancouver, how do you roll these kind of things out across Canada with, the makeup of our country? It's huge, it's wide, it's a lot of small communities. And it's just perplexing that, we're struggling in a place like Vancouver to get it right and still going backwards in Ontario for sure by these cuts. So you wonder, like, is there something wrong with the data? Are people not looking at the data? Is there something wrong with, just there's a misconception of the real problem? Like,
But it's also, I'm going to go back to ideology, right? So there's a lot of people
Yeah.
who believe that these people are getting their God-given just desserts because they chose to be junkies.
It's the lack of compassion.
100%, right? And
but these are not like construction workers that are suffering. These are, I'm not saying there should be any kind of, caste system to drug use or anything like
but
that.
there is.
Yeah, there is.
But there is. There
It is a
effectively
class.
there is, and really most of it is a war on the poor.
Yep.
You become a drug user when you're visible, and that means you're homeless. How many people are out there that are functioning alcoholics, functioning substance users, but you wouldn't know that?
It's kind of the reverse of John Porter because you can have people fall from high up. Porter talked about people coming into Canada and they go up through, social ladders and things like that. The drug use brings you down to the bottom, and
Yes.
that's
You lose everything eventually over time.
so
You can't.
you fall into poverty. So it doesn't matter.
Unless you can
You might
afford.
have been middle class. You might have been a wealthy person at one point.
Well, no, but if you get into good treatment,
Yeah.
which again, at 40 grand a month, you might be able to save yourself.
So, I mean, these are the problems that go back to painting this picture of safe supply as a solution, right?
Yes.
Yeah,
Because that's the,
that's the answer.
and when you think about the complications of rolling things out across Canada, all the training, all these other things, it comes back to one simple thing, is that safe supply is a solution. That's why Wani, with all his knowledge, all his experience, all the time he spent with it, he's come to that conclusion for a reason. Because that is the solution.
And I will say, I don't like being pointed to as the solution or the originator of anything. And I will deflect to the people who have come to that conclusion
Right.
are substance users who are most deeply affected by that. And I've supported, and I can say they're right, and I've supported, right? I want to introduce a term, okay? A very important harm reduction term that's important given this is an Ottawa audience. It's called vansplaining, okay? And
Can you say that, yes, sir?
vansplaining. And that is the potential for a lot of people to say, well, in Vancouver, we do it like this because we have had pioneering and innovative programs that have been accepted and they're because they've been around for 20, 30 years. There's, knowledge, like that's a generation of knowledge. But that doesn't work in every community. So these communities you're talking about, there's wisdom there. These communities know what they need and what they need to do. Kingston this week, those people know what the community in Kingston needs. There is a crossover that we of course can learn from each other. But the downtown east side is a very unique neighborhood globally. And the solutions there, especially if you walk those streets, Main and Hastings, Vancouver, they make sense there. They may be adaptable to other communities, but they're not the only solution, right? And so I will always like default back to mansplaining. It's like when I'm here in communities, it's to point to the wisdom that exists here, the engagement that exists here, that there are people doing it as volunteers, as paid people, under resourced, as moms who care because they've lost, that they're worried about their kids. They respond, right, and they know because of relationship and because of the history in their communities. And yeah, there is a lot of stuff that we've done in Vancouver that can be modeled or looked to. We've also made a lot of mistakes, right? And those don't need to be recreated. But it's really important to point out that I'm not, me coming here doesn't introduce anything new to this community. What it does is witnesses, shines a light on what's happening here. It hopefully builds community. I make new friends, and hopefully it fuels people to keep going, or to go towards self-care, or to whatever, right? But communities know what communities need, and that the wisdom inherent here needs to be honored, instead of people having to jump around and do gymnastics because people are dying, like, and we need to be seen. That's the unfortunate reality, is how much work people have to do just to be heard or seen.
And validating. So interestingly enough, when we did the conference in Kingston, colleagues and myself had traveled to Vancouver literally the same week last year, and so I had all these Facebook feeds coming out with memories of Ronnie and stuff in his domain, and we were there to learn. But the amazing thing was, it felt like we were swimming in waters where we didn't always have to be fighting against the current, because we were talking to people that they got it, or they got us, and we're so accustomed to having to justify our existence, and even the vilification. I mean, I have colleagues who have been, they've been called, junkie lovers, and awful things for very, very compassionate people. And so that's part of it too, is for the people doing the work, for someone to come in and say, I get you, and what you're doing is important, means a lot to these people, because the only people they have to support them is their own peers. And that's the reality. And that can be extremely lonely and hard on your mental health.
Well, I really appreciate all of this. We're running a bit short on time, but in the last 5 minutes we have or so, if somebody wants to somehow get involved or do something to make this a better situation, to join the community, do you have any suggestions and thoughts on what the average person can do?
The average person? Well, I mean, there are a number of organizations. Like, can we name some of the harm reduction organizations? I heard Sandy Hill, and there were some represented today. Somerset.
Yes, Sandy Hill.
So those organizations are the solution, not the problem.
Mm-hmm.
Just to keep that in mind. There are, I think this open letter that the Canadian Drug Policy I said Alliance, it's CDPC, Canadian Drug Policy Coalition, I'm sorry, that is active now, that they're asking people in their communities throughout Ontario to petition the politicians provincially and municipally to support that.
Stop the harm. We have an Ontario chapter.
Write your MPB, sounds like.
City councillor, MP, MPP,
Mom Stop the Harm.
Start talking
which is an
about it in your
organization, that was founded by mothers who had lost children.
Can you say that again? Moms
Stop the Harm. They're a national organization that have both provincial as well as local chapters. So that's a really cool movement. I would
Mhm.
describe it more as a movement, and they do annual memorials and so on, but also a lot of advocacy work with politicians too.
Thank you so much for all of you who heard this conversation. I hope that this will be a first of many that we have on the subject and on other subjects in our society that we need to do better on.
Yeah. Thanks so much.
Thank you.
For your time.
Thank you.
Appreciate it.